The first 1,000 days is the critical window of opportunity for a child's growth and development. It comprises 270 days of pregnancy, 365 days for the first year of life, and another 365 days for the second year. It is a period of rapid growth after which the effects of deficiencies will be hard to correct. Significant impacts on health and productivity can be felt even in his or her adult years and of course also affect the overall development of the community. Good nutrition during this crucial stage allows a child to bloom into the person he is destined to be, and pooling our efforts and resources with the goal of maximizing each child's potential will help you and me and your children and our children and their children to build a better world. The goal for today is to convince you that investing in the first 1,000 days is investing in the future. I'm Dr. Marini Esguerra. I'm a pediatrician and international board-certified lactation consultant. My vision is to cultivate the soil so that the seeds that we sow may be luscious, beautiful, and have great contributions to society. Here I am in my element, which is teaching and supporting families in giving breast milk to their children, and these are my disclosures. Let's say I want to plant tomatoes in my garden. What would I do first? I would choose the best soil and put it in the best sunny spot and make sure that they have enough nutrients, water, and sunlight so that they may grow to become the best tomato plant that they can be and have the juiciest fruit. Children are the same way. They need to be nurtured right from the beginning when they were just thoughts in their parents' heads. A healthy mother with a healthy pregnancy and natural birth, breastfeeding, and subsequent complementary feeding with indigenous food given at the right time. All these we do are for the child to become the best child and best adult he or she can be, so that she may continue to give us joy and contribute to society. Nurturing a child starts at conception, and this is part of the 1,000 days. Consequences of poor nutrition during pregnancy are: mothers are at risk for maternal death and are likely to give birth to a low birth weight infant, iron deficiency anemia, folate deficiency, iodine deficiency, and maternal complications such as gestational diabetes, preeclampsia, and premature delivery, and maternal death. After 270 days of pregnancy are 160 days comprising birth to 6 months. Pregnant mothers should give birth in a birthing facility with the help of a trained professional, such as a doctor or midwife, to ensure that birth protocols are followed and maternal and fetal complications, if any, are properly managed. The Essential Intrapartum Newborn Care Protocol adopted by the DOAH since 2009 outlines life-saving 4 steps, which consists of immediate and thorough drying of the newborn, early skin-to-skin contact between the newborn and the mother, properly timed cord clamping and cutting, early initiation of breastfeeding within the first hour after birth, and continuous non-separation to defend the newborn against infections. Breastfeeding is started on the first hour of life. Only breast milk is given until the baby is 6 months old, and that's when complementary feeding is started. Thereafter, the baby continues to be breastfed until the child or the mother decides to stop, usually around 4 to 6 years old. Nutrition is like a rainbow. All the colors need to be present for it to become a rainbow. And breastfeeding is like that. It is species-specific and tailor-made by the mother for her child for every situation. It is a nutritive fluid that is composed of many magical ingredients that is meant to nurture and protect. Breast milk substitutes exist for cases when breast milk feeding is not possible. However, it has never and will never ever measure up to the nurturing and protective properties that breast milk has. Human breast milk, not cow breast milk. Well, this is certainly a busy slide, and it's taken from the World Alliance for Breastfeeding Action. It shows the most common consequences to the mom and baby when not breastfeeding, and I discuss this at length when I'm doing breastfeeding classes. But for today, I just want to highlight that in many years past, studies have shown that non-breastfed babies have a higher risk for pneumonia by 77%, and mothers with GDM have higher risk to have diabetes type 2 when they have decreased risk to have diabetes type 2 when they breastfeed their babies for 2 years. Not breastfeeding costs the family. Obviously, it costs them formula milk, water, appliances, but it also costs the medical appointments, since non-breastfed babies and children and even adults have more illnesses and admissions that may lead to child or maternal mortality. They can lead to cognitive losses, and on top of that, it costs us all an adult who is sickly, underproductive, socially lacking, and would probably have bad teeth. And from the occupational health perspective, we know that a lot of healthcare claims are from dental appointments from bad teeth. Plus, there is an increased carbon footprint from powdered formula milk production and all the materials needed in plastics and disposables when not feeding directly at the breast. Next comes the next 550 days, which is the 6 months to 2 years. At 6 months, the baby should start to receive appropriate complementary feeding while continuing breastfeeding. 6 months to 2 years of age is a critical period of a child's life because deficiencies and illnesses during this period can contribute significantly to undernutrition, particularly stunting. Healthy, locally sourced indigenous food are given with the 4 components in mind. Timing, when, which is around 6 months. Adequacy of amount, like how much and what are you giving. Definitely not processed food. We can use indigenous food that is plentiful in the Philippines. Safety, like hand washing, proper preparation and storage. Active feeding, where the child is a participant and the caregiver responds to feeding cues and signals. When these are not in mind when giving complementary food to the baby, breastfeeding can be compromised and result in poor infant nutrition, where the child may become stunted or wasted and lead to retardation of growth and development. Unsafe and contaminated complementary food and water, as well as poor hygiene and sanitation, increases the risk for infections and diarrhea that can significantly affect nutritional status of children. Our invisible enemy of malnutrition comes in various forms, including stunting, wasting, and hidden hunger or micronutrient deficiencies. The 2015 National Nutrition Survey tells us that 1 in 3 Filipino children 0 to 6 months old are stunted or short for their age. This statistic is equivalent to about 4.6 million stunted children nationwide. Imagine the magnitude of stunted children in our country. They essentially can comprise an entire region. Also, a form of our invisible common enemy is wasting. The National Nutrition Survey 2015 estimates that 1 million Filipino children are thin for their height, wasted, or acutely malnourished. 1 million is close to the 2019 projected population of Zamboanga del Norte, which is 1.1 million, and is more than the combined projected population of other cities in the country. The 1 million children with acute malnutrition demands urgent and emergency response from the government. International studies show that children with severe acute malnutrition are 9 times more likely to die than children who are well nourished. In the latest result of the National Nutrition Survey for 2018, stunting is now recorded at 30%. Filipinos are shortest in the ASEAN region. The Philippines is on the 9th global burden for stunting and the 10th on global burden of wasting. In the ASEAN region, you will see that the Philippines has the highest rate of low birth weight children. These are the children born out of mothers who are not able to maintain maximum nutrition during their pregnancy period. Stunting is not genetic. Nutrition is the most important external factor affecting linear growth. Critically, different nutritional components received during both the time in the mother's womb and the period after birth are linked to adult height. Stunting will have significant effects in a child's future. A child cannot recover height in the same way that he or she can recover weight. So stunting may forever. Aside from physical development, proper nutrition in the first 1,000 days is critical to the cognitive development of every child. Proper nutrition in the first 1,000 days of a child produces positive impact in his or her personal health and development as a child and his or her productivity and family health later in adult life. Well-nourished children in the first 1,000 days are 10 times more likely to overcome life-threatening diseases such as measles and diarrhea. They complete 4.6 more grades in school, go on to earn 21% more wages as adults, and are more likely as adults to have healthier families. The total future economic losses from undernutrition is estimated at $4.5 billion annually. This is equivalent to 1.5% of GDP in 2015, which is almost half of the total DepEd 2019 allocations for personal services, MOE, and capital outlays at 9.5 billion US dollars, close to the combined 2019 allocation for DOH and DSWD at 4.49 billion, more than the 2019 allocations for DSWD plus the special provisions for the 4Ps, which is at USD 4.3 billion. Whereas the result to investment in nutrition is very high and very simple. This conceptual framework on the causes of malnutrition was developed in 1990 as part of the UNICEF nutrition strategy. The framework shows that causes of malnutrition are multi-sectoral, embracing food, health, and caring practices. They are also classified as immediate, underlying, and basic, whereby factors at one level influence other levels. The framework is used at national, district, and local levels to help plan effective actions to improve nutrition. It serves as a guide in assessing and analyzing the causes of the nutrition problem and helps in identifying the most appropriate mixture of actions. Stunting can be caused by long-term and consistent deprivation, which occurs primarily due to poor nutrition and diseases. The underlying causes of poor nutrition and disease include household food security, inadequate maternal and infant feeding care, unhealthy household environment, and lack of access to healthcare services. So what can we do? Here's what we can do. We can ensure adequate iron and folate supplementation before and during pregnancy, ensure a healthy and diverse diet for a woman who is pregnant, ensure that women deliver in a PhilHealth accredited birthing facility or hospital where there is a skilled birth attendant. Mothers should initiate breastfeeding within 1 hour of birth and be supported to breastfeed exclusively. Protect and build upon the milk code and the breastfeeding in the workplace and in public. Children should see and understand that breastfeeding is normal so that they will become adults who will also see that breastfeeding is normal. It should be shown in schools, school books, and accepted in meetings and events and public events. We should teach families about proper complementary feeding. There's no need to buy those pre-packaged and bottled food. Babies at 6 months and above should be eating naturally prepared food that are native and plentiful in the Philippines, and we can even plant them in our own backyard. Good coverage of deworming, routine immunization should be achieved, and there should be integrated services with programs to improve hygiene practices such as hand washing, which apparently is not common. And we just found out now that there's a COVID-19 pandemic, and access to sanitation facilities such as toilets. We can ensure that all barangays have access to standard quality equipment like weighing scales, necessary for routine measurement of weight, height, and mid-upper arm circumference of children, and people who know how to use these tools. With good data collection, research, we can guide planning and prioritization of our resources. Children with severe wasting are at immediate risk for dying, and they should be provided with ready-to-use therapeutic food and routine medicines according to national standards and protocols. Our support of the first crucial 1,000 days of a child's life has a tremendous impact on our personal lives and community. It is the best investment a country can make. Each little or big thing we do has a cumulative effect in our future. Times are uncertain these days, and we don't know anything that the future brings, but there's one thing that we know for sure. It will not be us who will be there to live it. It will be our children. So let us give them good soil to grow on. Our bodies are our gardens, to which our wills are gardeners. There are so many things that you can do, and you know that you can do it, but will you do it? The body is like a car in that it needs correct fuel to keep going. If you constantly put low quality fuel in your tank, you're going to run into some health problems. So stop wishing and start doing. Thank you.